Nothing derails your finances like an unexpected health issue. Sure, you may have private health insurance or perhaps you're enrolled in NHI, but there are direct and indirect costs that private health insurance and NHI do not cover. This is why it's so important to learn about different health issues that could potentially affect you or someone in your household. Today, we're going to learn about a health issue that affects 1 in 3 women, pelvic floor disorders. What is a pelvic floor disorder and how does it impact your finances? Keep watching to find out. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome to You and Your Money, everyone. Again, today we're talking about pelvic floor disorders in women. Today's guest is Dr. Laura Desrosiers. She is a board-certified OB/GYN and urogynecologist, which is a specialist physician who treats women with pelvic floor disorders. Dr. Laura is part of the medical staff at Doctors Hospital. Dr. Laura, welcome to the show.
Thank you, Ria. It's a pleasure to be here. Looking forward to this discussion.
Now, of course, as we talk about the economic impact, let's get into understanding what is the pelvic floor and what causes a pelvic floor disorder.
The pelvic floor essentially is the group of muscles and including musculature, of course, ligaments, and bony structures that help hold the bottom part of our bodies called the pelvis, right? And through them, there are organs that also have function. They function, our urinary organs help which includes the bladder and urethra, allows us to hold the urine appropriately and empty appropriately. The vagina and the cervix and uterus for people who still have their cervices. And then, of course, the rectum. All of these organs go through the pelvic floor musculature. So when you have disease processes that affect any of those, you have essentially a disease process within the pelvic floor.
Now, what are some of the symptoms that may indicate that a woman has a pelvic floor disorder?
There are lots of symptoms, and the symptoms will vary depending on what component, what part of the pelvic floor is being is damaged or is demonstrating a dysfunction. So, for example, urinary urgency and frequency may be a sign that you have issues of prolapse. And you may say, well, you know, if it's your urine, you're not necessarily feeling a bulge, but that may be the first symptom that you'll have. Another symptom may be a symptom of pressure, almost feeling like something's coming out of the vagina. And sometimes when women dare to look, they'll see, oh, well, there's a little bit of a soft ball or a little bit of pink tissue that's protruding from the opening of the vagina. Well, that would signify that there's a prolapse issue. There may be some defecatory dysfunction, constipation, or sensation of incomplete bowel emptying, or even fecal incontinence. All of these are within the auspices of this disease process.
One of the most common pelvic floor disorders is urinary incontinence. Talk about the different types of urinary incontinence and its prevalence amongst women.
Yeah, so there are several types of urinary incontinence. Stress urinary incontinence is probably the one that most people know about, and that's leakage with cough, laugh, sneeze. Urge incontinence is overactivity of the bladder where you feel the sensation to use the restroom and it can't be deferred. So typically women will say, I know where every bathroom is, or, I am going to the restroom before I leave home, when I get to where I'm going, before I leave where I'm going, etc. So those are also, that's a second type of incontinence. And then there are neurogenic bladders where women don't completely empty their bladder. Incidentally, they can have symptoms of incontinence, but it's not because of stress or urge. It's because their bladder is never completely empty and the pressure builds up in their bladder and overcomes the urethral pressure and they leak. Leakage can happen with or without sensation in those instances. Typically, there's an underlying neurologic issue that's going on, but sometimes that can be the first way that we actually diagnose that there's something that's going on neurologically. So those are, just to give you, an overview of the different types. You can also have a combination. You can have mixed incontinence where you have both leakage with cough, laugh, and sneeze, as well as urgency, so the gotta go.
For those persons that may be experiencing these, the various discomforts that may come with it, what costs are associated with treatment and care?
So we're wearing a pad, maybe we're changing it once a day. There are plenty of patients that are changing it 2 and 3 times a day. So we're going through several packs of poise within a month. So, pads within themselves can cost several $1,000s with that, and then pose, if we're not changing them on a regular basis, and that increases the risk of infection. A urinary tract infection to be diagnosed is, probably $100 to be on antibiotics. But, depending on who you are, certain patients will have gross hematuria with urinary tract infections. It may take away time from work, etc. So there are costs, which we tend to call them direct and indirect costs. The direct cost is the cost that the patient can see, but the indirect costs are costs of, maybe time from work, time from their family, time from being able to take care and do their normal activity with family. So the costs they can mount up quite quickly.
As you talk about the cost and having to possibly take time off from work, what sort of impact does urinary tract infection actually have on employment?
I feel like we can do a session just on UTIs by themselves. You're right, their diagnoses, the over-treatment of antibiotics, the over-diagnoses of UTIs, defining them, etc. However, bring me back on another time so we could talk about it. UTIs are a huge problem, huge burden, not only to the family, but to institutions at large, right? So urinary tract infections are an infection that where you have bacteria binding to the walls of the bladder, causing pain with urination. So when you urinate, it hurts. And so even if you do go to work, you may not be able to function at the level that you normally would function at, depending on how bothersome it is. Some patients will have, as I mentioned before, symptoms of blood in their urine, right? So that then in and of itself requires us to have a further evaluation. Is it just coming from the bladder? Is there anything that's happening at the level of the kidney? Typically it involves imaging, so that brings in additional costs. So UTIs can be quite costly to the patient who's having both the pain of the urinary tract infection, the cost of the diagnoses, which we would diagnose it with a urine culture and sensitivity. I would, recommend that if you're having symptoms of urinary tract infections, please don't just say, "Hey, doc, I'm having a UTI. Can you send me a medication?" Because we have learned that with that management style, it increases the risk of resistance, meaning that the bacteria over time will become resistant to the antibiotic that we're giving, and it makes it much more difficult to treat with additional when you have other urinary tract infections. Not only that, it increases the risk of needing very potent antibiotics that sometimes cannot be given orally and would need to be given intravenously. So that routine I really would dissuade persons from doing. I really would recommend that we're appropriately managing, identifying, diagnosing the UTI, making sure that the appropriate antibiotic is prescribed, and then also for the number of days that they're prescribed for. In the interim, when patients are waiting for a diagnosis of the UTI, there are certain things we can do. We can give Pyridium, there's methylene blue, there's Urabel. There are other medications that we can give to decrease the risk of pain and, of course, decrease the risk of having an infection that makes its way towards the kidney.
How are pelvic floor disorders actually diagnosed?
So we recommend that that you're seen by somebody who's trained in this area. So I would say start with your family practice, physician, your either your internist or family medicine physician that you see on a regular basis. If you're having these symptoms, that really should be the starting point. They can evaluate and see if there's additional evaluation that would be needed. Oftentimes, I think that people are not sure where to go, and you have a trusted, particularly with pelvic floor disorders, it's a very sensitive area, right? So we really want to start with people that you feel comfortable with, that you have been working with for a while. OBGYNs are trained also and familiar with pelvic floor disorders, and will also be able to give help with diagnosing this disorder. And then ultimately, someone who is trained in urogynecology will also be able to diagnose what's going on.
Dr. Laura, I think that was really good advice that you gave just now, to make sure that we find that trusted person who can definitely give us the advice that we need, so that we can make sure we are making the right decisions and not impacting ourselves in the long run. We have to take a quick break. We have so much more to talk about when we get back. This is You and Your Money. We'll be right back.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Doctors Hospital's Pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Welcome back to You and Your Money, everyone. If you're just now tuning in, Dr. Laura Desrosiers, a board-certified OB/GYN and urogynecologist at Doctors Hospital, is today's guest. Today we're talking about pelvic floor disorders, what they are and how they affect your finances. Dr. Laura, before the break, we talked about urinary incontinence, a common pelvic floor disorder. There's also another type of pelvic floor disorder called pelvic organ prolapse. Can you share what this is and the various types that can affect women?
So pelvic organ prolapse is when you have dropping of various parts of the vagina. So we like to divide the components of the pelvic floor into anterior, posterior, and apex. The anterior would represent where the anterior wall of the vagina is. And so if you have prolapse within that compartment, we call it a 𝗖𝗧𝗧𝗧. We'll say, oh, your bladder dropped, but it's really the anterior wall of the vagina that's coming down. The posterior portion of the vagina is where the posterior vagina sits. And if you could imagine the vagina being a room, the anterior wall would be the ceiling, the posterior wall would be the floor. So the anterior wall, if I poke my finger through, I'm in your bladder. The posterior wall, if I poke my finger through, I'm in your rectum, to give you some perspective. And then the apex would be where the cervix sits, for those who still have a cervix and a uterus, or where the cuff is for those who've had a previous hysterectomy. When you have prolapse in any of those compartments, we call that pelvic organ prolapse. We use different ways of speaking to each other as urogynecologists to describe this and to stage the prolapse. That's really not important. But the important thing is to know when you have this, or we can diagnose it with an exam, a physical exam. The exam's a little strange sometimes, and so it does require us to use a speculum. We're not doing a pap smear. What we're doing is specifically looking what compartment of the vagina is coming down.
At what point is surgery required and what's the cost?
This is a quality of life issue. So if the process of prolapse starts to, the condition of prolapse starts to impact your quality of life, it's a good idea to have an intervention and to seek help. My old adage is that you don't really have to do anything unless it starts to impact your ability to empty your bladder. So remember, we talked about earlier that the most important part for us is to make sure that we're protecting the upper GU tract. With prolapse, you can have urinary retention, and we can see that actually quite frequently. So it's very important to make sure that if you have prolapse and you decide to do nothing about it, that you are still able to empty your bladder. When you're not able to empty your bladder, you may decide not to have surgery, but you certainly need to have an intervention so that it doesn't affect your ureter or the kidney. Now, in terms of surgery, surgeries can be either vaginal, abdominal. Typically, we recommend vaginal procedures for patients. It depends on how old you are, how active you are. We have various surgical interventions depending on what the presentation is. And of course, what their comorbidities are. Those will determine how we're able to give them the best guidance in terms of surgery. Cost will vary depending on the various modalities that we use. So if we do a laparoscopic procedure, then we're typically, that's, we're using small keyhole incisions to look inside of the pelvis. We're suspending the top of the vagina. That can be anywhere from $10,000 to $15,000, depending on how much dissecting we're doing, and if there is a hysterectomy that's involved with the procedure. If we are doing a vaginal procedure, typically that's going to be a little less because we're not using as many instruments. So a vaginal hysterectomy may run anywhere from $8,000 to $10,000, depending. Of course, it all varies with what insurance the patient has, etc.
How does the actual recovery process after the surgery actually affects the patient's ability to work?
For pelvic organ prolapse surgeries, we're really strict on that recovery process. We're not just interested in doing surgery, we're interested in outcomes. And so our recovery process is typically 6 weeks. 6 weeks of no heavy lifting, 6 weeks of no intercourse, nothing in the vagina, no sex, no tampons, no douching is what we like to tell our patients. It's very, very important. And I won't perform the surgery unless we're able to have that time, because oftentimes we need to allow for tissue ingrowth, we need to allow the tissue time to heal. And so that doesn't necessarily mean that you can't do anything. We actually want our patients up and walking the day, the day of surgery. So we want you ambulating, but we don't want you doing any heavy lifting. The restrictions are quite clear. Nothing heavier than 10 pounds, and we actually will have you come in at intervals so we can follow up and make sure that everything's going appropriately.
Is repeat hospitalization common after surgery?
Typically not. The hospitals stay depending on what procedure we're doing. If it's a laparoscopic procedure, then you may go home the same day or the following day. We, of course, are going to check to make sure that all the parameters are normal so that you can go home. We don't typically see rehospitalization. If we do, then we want to figure out why that would be. So typically, no. But I think the reason that we're not seeing rehospitalization very often is because we have set parameters to help decrease the risk of having a hernia after this procedure, right? So the whole no heavy lifting is because we want to make sure that the sutures that we've used to close any openings in the belly have had ample time to heal. And we want to also make sure that, that we're not having any intercourse that decreases the risk of a bacterial infection that can make its way to an area that's just healing. So we take precautions, and I think that that's why we don't see rehospitalizations.
Dr. Laura, you seem like you're so full, and this is definitely a topic that you love to talk about. What is the cost of a consultation with you?
It'll vary, but on average, a cost of a consultation is about $250. Obviously, it varies if you have insurance or not. I'd like to say that we are here to work with the population. So if there is a cost issue, we don't want that to be the only reason why you don't seek care. We certainly work with patients. At Doctors Hospital, we've made it a priority to be able to see our patients, whether or not they are insured or not, especially for our elderly population who have worked in the society and the community for many years. We've set up a program where there can be a pay-as-you-go, particularly for patients who need surgery. We've started this process. I have to thank the administration because they've been quite supportive and helpful with establishing that for our uninsured patients or underinsured patients that need to have procedures. So do reach out to us and we will work with you.
Thank you so much for providing that extra tip that you're not necessarily considering or just having to think about, what the procedure is, the cost is, but you're really looking out for the well-being of patients. Now, Dr. Laura, we do have to take another break, but once we get back, I want you to provide further tips on how users can actually avoid the financial burden of a pelvic floor disorder. You're watching You and Your Money. We'll be right back.
Doctors Hospital's Pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
At Doctors Hospital, our lamp just got brighter. The 𝗖𝗢𝗡𝗡𝗘𝗖𝗧 membership program now has 3 unique plans to choose from. From lamp prepaid with free prime care visits and service line discounts, lamp insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new lamp access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 𝗖𝗢𝗥𝗚𝗘𝗖𝗧 facilities at 𝗵𝗠𝗧𝗛 Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Welcome back to You and Your Money. Today's guest, Dr. Laura Desrosiers, board-certified OB/GYN and urogynecologist at Doctors Hospital, is still with us. We've been talking about the economic impact of pelvic floor disorders. Dr. Laura, before we go, what are some lifestyle changes that can help with prevention?
Lots of things that can. I think it's important that we first recognize that there are things that can be subtly sort of in the background before you start to see issues with pelvic organ prolapse or incontinence. For example, patients who have chronic constipation. We know that chronic constipation is an independent risk factor for developing prolapse. More so, we often like to tell patients, if you've had a pregnancy, if you've had babies, if you had big babies, if we used forceps for the delivery. But chronic constipation tends to be in the background that is really seldomly addressed. So our patients who are who have chronic constipation, that needs to be addressed, and they need to know that that is an independent risk factor for the development of prolapse. So addressing it, making sure that we're using the appropriate things to help us, stool softeners, avoiding foods that make us constipated, incorporating enough wheat in our diet, and of course enough fiber that can help us with that. And then also utilizing things that may be simple interventions. In my office, I have had to buy a squatty potty so that patients can have access to it. I know it sounds crazy. A stool for when you're having a bowel movement, it can make a huge difference. So addressing things like constipation. Addressing things like heavy lifting, for example. So for patients who are constantly lifting heavy items, and it may be that you have a job where that's what you do, it's understandable, but use your body mechanics appropriately. And then also seeking help before it becomes a problem, right? So one place that I think that we can do a huge intervention is really working with women who are pregnant and have had babies. This is the best time for us to have an intervention. Pretty much everyone who's had a vaginal delivery will have a little bit of pelvic floor disorder around their peripartum time, right? Their time immediately after the delivery. We expect it, we anticipate it. What are other countries doing? In Europe, in fact, it's mandatory. Every woman during their last trimester of pregnancy will meet with a pelvic floor therapist, and they'll have a plan for managing both during the delivery process as well as postpartum. I highly recommend it. Particularly if it's the first delivery. I highly recommend meeting with someone to talk about what are these muscles, how do I gain the best activity from them, right? And you can do that on your own. We all worry about our abs and our deltoids, making sure that we look fit, but we forget about the most important muscles in our body. Through these muscles, the urethra, the vagina, and the rectum come through these muscles. So they play a huge role in our function and quality of life. So working with pelvic floor therapists for our patients who are about to have a baby and have just had a baby. I also highly recommend that we make time for ourselves. For example, if you're working in a job where you feel the need to hold your urine for long periods of time, these are unhealthy habits that can lead to problems later on. So make sure that you have, that you are going to the restroom on average every 3 to 4 hours. Don't wait 6, 7 hours, 10 hours and you've not gone to the restroom. That takes a toll on your bladder. And then of course, making sure that we're drinking enough water. I cannot emphasize enough. Obviously, there are lots of other reasons why drinking water is very good for you, obviously good for your skin, but it's very, very important for your kidneys and your kidney function, as well as your urinary bladder. The water is actually, it dilutes all of the other things, the noxious substances that get placed, that are coming through the bladder, right? So it decreases the acidity, it helps you not to have as much urgency and frequency. So drinking enough water. I can sit here and talk to you all day about other things that you can do, but I think this is a good start for things that you can do to help with decreasing the risk of having disorders in the future.
Wow, Dr. Laura, thank you so much for coming on the show today and sharing so much information with us.
It's been such a pleasure.
To make an appointment with Dr. Laura, you can call the Centerville Medical Center at 302-3250 or Doctors Hospital at 302-4600, extension 5557. Thank you for watching today's episode of You and Your Money. If you haven't already followed You and Your Money on Facebook, please do so and tune in next week for a brand new episode. I'm Ria Christina. See you next time.